Hey guys, Dr. Shook here. I just wanted to follow up for just a quick something very quickly I wanted to share with you guys. Just to follow up to this morning's live video because I was thinking about what are some of the ways in the video I posted earlier today. I talked about the psychoneuroimmunology of recovery and how that can impact your ability to dampen or have continued autoimmunity. And I think one of the things that I wanted to share with you guys was that you had to focus on the psychological aspect of your health because it affects the nervous system, and in fact that affects the immune system. So one of the things that I do is whenever I write the things I'm thankful for, I use the 5-minute journal. Whenever I write those down, I speak some affirmations. And some people are like, oh, that's hokey, whatever. I don't think so. I don't think so. Sometimes you have to declare what you want and what you believe. You have to speak it, I think, sometimes, and you have to remind yourself, and you have to speak it with some conviction. So one of the things that I do is, one of my affirmations is that today is my day, and that no one will tell me who I am or what I can be, and that today is my day. And I speak that, and sometimes it's a really strong driving force because there are a lot of things that pull against you, and you have to know that you have the ability to take control of your life, and that no one's going to do it for you, and you have to do that for yourself. And you have to put your foot down and say, you know what, today is my day, and no one's going to tell me who I am or what I can be. It is my day. I'm going to make it. I'm going to make it the best day possible, and I'm going to conquer this day, and it's mine. And so I do that with a lot of my with my journaling. I use that affirmation, and it really helps me out. And all I have to do is, if you don't understand and you can't feel that, like I get like goosebumps when I speak that, because see, a lot of people don't have today, and you have today. And you need to put that in perspective. No matter how desperate you are and how difficult things may be for you, you have the opportunity of today. A lot of people don't have it, will never have it again. And you got to be thankful for that, and you've got to make the most of it. So that's just my 2 cents. I got to get back to the seminar, but I wanted to share that with you guys because that's really important to me. It's really important to me, and I think that's changed my perspective on my own beliefs. Because sometimes if we don't believe that we are worthy, if we don't believe that we're deserving of something, we'll never achieve it. And we all take our belief system and our self-worth, they take work. They do. And sometimes we don't have great support systems, and we've had experiences throughout our life that have torn us apart and torn us down. And you have to start telling yourself that you're worthy of being healthy, and that you're worthy of a great life, and I think that will take you far. So anyway, I really appreciate you guys, and I hope this helps you out. I think it's going to make a big difference if you'll just take my advice and do that. But because I got to get back to a seminar. If you missed the Facebook Live video I posted earlier today, check it out. I go through talking about the psychoneuroimmunology of autoimmunity, and how it's something that's greatly overlooked, and that diets alone and supplements alone, and even all the lab testing and things you can do in the world won't help you if that is the primary thing that's tearing you apart. So just check it out if you get a chance. Really appreciate you guys. Give me some love and some likes if you like these videos, and please do share them with other people so that I can help educate others, because I'm going to try to teach you guys exactly what I would teach anyone that I would work with. And it's really the stuff you have to do first. Anyway, so appreciate you guys a lot. I hope you guys have a wonderful, wonderful day. Thank you for the comments, guys. I would love to, Trish and Lisa and Aaron, I would love to answer some of your questions, guys, but I have got to get back to where I'm at a seminar today, and we're kind of masterminding on some ideas and ways that we can really help change the world and help people help themselves. So I'm getting ready to listen to a doctor that's been doing that and utilizing some technology and some other things, which I'm a big fan of. As you guys know, I'm a big fan of technology and using that to leverage our time and duplicate ourselves so that we can help other people help themselves. But really appreciate you guys. Hey, Susie. Yeah, I know. Isn't it just ridiculous? We just want that's what happens. I mean, we're in a, I was raised in a medicine cabinet. I wasn't raised in a household at all that we were aware of nutrition or anything. I mean, I was a child of the 80s. I was born in the 70s, but I grew up in the 80s. And, we had all the, I think I've said this before, but you guys might not have seen it, but we had all the snack wells, and we must have had, I couldn't tell you all the diet sodas, and just, listen guys, if you don't know, that's terrible for you. Those things are terrible for you. And ice cream, and I remember these push pops that had all these different artificial colorings, that made them red and green and blue. And I just think about all the garbage and things that I ate. And so yeah, it's very much, I was raised in a medicine cabinet. It was antibiotics for everything. The least little bit of cough, my mom to this day, fortunate that she's still with us, but to this day, if I cough, she's like, "Oh, you sound like you're getting sick. I think you need an antibiotic." And I'm like, "Oh, no, I only want that if I absolutely have to have it." But there's just, it's just perspective, and a lot of us have been programmed, right? We're programmed, and that's what it's like. It's like we were a medicine cabinet society, and everyone's looking for the medicine for their problem, and everyone has been brainwashed to forget that the body heals from inside. It's amazing. I mean, and that's not like another hokey concept. Cut your hand and see what happens. Cut your hand. Don't cut your hand, but if you cut your hand, let me rephrase that. Do not cut your hand. If you cut your hand on something and you don't need stitches, what happens? It literally will stop bleeding, it will clot, and you'll start healing. And the body's inborn process of self-preservation takes over, and it will heal, and it will scab, and the scab will fall off, and your skin will look new, and it will repair. I mean, we've neglected that, and that's really what this healthcare approach that I teach, and that there's a massive movement to support is all about. It's about respecting that, understanding that, and working to utilize the self-healing of the body to optimize health. And at the same time being aware that we have modern medicine that can help us too, right? If we need, and it's really about trying to be, work with the body as much as possible, but not neglect the fact that we have, wonderful discoveries and things that are beneficial to all of us living better. So anyway, hey Lisa. Yeah, there's some bad weather. It's raining here. If you guys want to see out my window at the hotel, I'm kind of standing in front of it. We got rain coming down. You could see out this way the skyline of Atlanta, but it's raining. Yeah, it's not good, but we'll be leaving here tomorrow, and hopefully we'll have some good weather. But anyway, really appreciate you guys. My thoughts on LDN, Deb, is that I think it's helped a ton of people. I personally try the best that I can. I find that a lot of times people haven't had, there's a lot of factors, right? So I don't want to sound like there's only one way, because there's not one way, but a lot of times LDN is used to get to help better regulate the immune system is what it comes down to. And so it helps with regulatory T cell function, which is what I talk about a lot. I talked about a lot this morning, was regulatory T cell function. And LDN can be good, but I find that a lot of people, most people that I've seen and people that I talk to, and even if they've seen other doctors, they haven't really been presented with or worked up properly, in my opinion. I mean, I think there's good ways, and then there's like the best ways. And what I mean by that is, so if you're autoimmune, if we're going to do further work than just say diet and supplementation based on what we understand about your physiology and what's happening, the best way to work it up is to actually do testing, advanced testing, and getting quantitative numbers that show us whether or not is your immune system reacting to a food. Do you have infections? Do you have reactivity to environmental chemicals? Do you have sex hormone problems that are fluctuations that, or cortisol issues that can cause impaired ability to repair and recover? Now, that's the best way. That's not accessible to everyone, and I completely understand that. So that's why I try to teach and help people figure other things out. And maybe LDN is kind of a way for people to get some help when they don't have access to some of those things. But there are a lot of people that take LDN that do have access to advanced testing and have the resources to do that. So I think it's all relative. I try not to really. I know it's helped a lot of people, but I don't. So I personally I think that working to try and figure out the drivers of the problem are most important, and then once you do all that, that can be an adjunct to help you better support the immune system if your best efforts fail. So I hope that makes some sense. April, thank you. I will be safe. Enjoying the conference. It's a lot of fun. I'm meeting. Oh man, I've had some very interesting conversations. There's a diverse group. There are a very diverse group of people here. I met a guy. There's a machine called ArcFlex. And it's basically like an exercise machine that is constantly getting feedback from your body. And you can get like an amazing workout, and it's in about 10 minutes. But they're doing some groundbreaking research with this thing on people that have really serious conditions, sarcopenia, which is like muscle wasting disorders. I mean, it could be used for high-performance athletes, everyday person, but they're really doing some great research with it. And they're incorporating functional medicine with these different types of technologies, and really just there's some amazing things. I mean, there's neurofeedback people that are here, like they're vendors and whatnot, but neurofeedback, a lot of like biohacking stuff. I'm really, I love thyroid and I love what we do, but what I do with myself personally is I'm more of a human optimization. I experiment on myself with that stuff. I do work with people to do human optimization. If someone doesn't, like, I'm not sick or I'm not really struggling with a problem, but I need to know how I can achieve like optimal peak performance with my brain, with my hormones, with so I do some of that too, but that's not something that I really talk about to the masses of people because it's just there's a smaller group of people, and I don't know. There's a lot of good that I can convey and teach with. Working on autoimmunity and Hashimoto, so that's what I primarily teach and I promote. Hey Mindy, extreme anxiety every morning. There's so many things that can contribute. I'll tell you, like, you always got to go back to basic physiology. If you're hypoglycemic, that's a big deal. Like low blood sugar, man, that's a really, really big deal that can promote anxiety. But there are a lot of different things, so that I would just say I can't really answer specifics because I don't know about your case or anything, but in similar cases I see people that have anxiety and they can have hypoglycemia, which is low blood sugar in the morning, and when you have low blood sugar, it triggers a stress response, and your body will make cortisol and adrenaline at the exact same time. It's why when you get low blood sugar, you can kind of get shaky. It's because of the adrenaline, and that can make you feel like you have anxiety, heart palpitations. There's several things. Hey, Carrie. Hope you're doing well. Hey, Susie. I can go to the conference now, thanks, I know. But can you do something on sarcoidosis in the thyroid at a later time? I'm going to tell you, there's not a ton of information on sarcoidosis. We believe it's autoimmune, and somebody might tell you that it is 100%. I think it is autoimmune. I'm not going to say exactly specifics, but I'll just say I have a very close relative that has sarcoidosis. Very close relative. It's very prevalent in the southeast, and we don't really know exactly why. But I have a very close relative that has sarcoidosis. We actually thought that my relative had lung cancer, and there was a biopsy done. It was really scary, and it was sarcoidosis. So I believe, it's autoimmune. I believe that it's an autoimmune process. So what we do with sarcoidosis is like other autoimmune processes, we investigate what's happening in your body, and then we work to identify, like, so if we can identify triggers of the immune system, or things that are driving or that are exacerbating the immune system. So primarily through immunological blood tests. So you draw blood and you have a lab analyze it for, again, all kinds of different infections, all kinds of different food reactivity, like partially digested food proteins, all kinds of environmental chemicals that your immune system could be reacting to. That's where you really get good quantitative information, so you can say, all right, these are problems. We need to remove these from your environment as much as possible. We need to do some things to help support healing the systems of the body that may have been damaged due to the exposure to these infections or foods or chemicals. And we need to work on repairing the physiology. And when you do that, you can calm down. Now, I've seen it so many times, you can really calm down the immune system. And so that's like with sarcoidosis or any autoimmune condition. That's the approach that that if we have as an option, that's the approach that we want to take to get really good quantitative measurable information. Because I'm a big advocate of dietary and lifestyle changes, and that's huge. That has to occur. There's no way around it under the model that I work with. So you have to make these dietary and lifestyle changes, but at the same time, a lot of people react to foods in the diets that we suggest. So it's like, yeah, there's probably a better way to eat. There's definitely a better way to eat than the standard American diet. And we know there are foods that are reactive, that a lot of people react to. So if you have certain foods in your diet, like gluten or casein, which is dairy, or soy, eggs are huge, and then lectins and agglutinins, which are in like legumes, beans and peas and stuff like that, some seeds, those can be very reactive to the immune system. So those are good places to start, but a lot of people will do those things and they either don't feel a lot better, or they don't feel better at all. And you just know that no matter what you do, like, so if you implement a dietary plan or a dietary approach and you don't feel better, then that's also diagnostic. It tells you that what you're doing is not addressing the driver of the process, or most likely it's not. The most common problems you see with diets is when someone makes dietary changes, they tend to not eat enough food because they hate the food, or it's just not appealing to them. And I get it, but we got to eat to live sometimes, and not just live to eat. So you've got to. A lot of times people don't eat enough food. They don't eat frequently enough, so they get hypoglycemic. They cut out, like with a lot of diets that you can find, they're autoimmune based. There are a lot less grains, and grains keep a lot of us regular, like our bowels, but it's not really necessarily good. This is because they have soluble fiber that can actually pull water with it that our bowels move. But really the insoluble fibers is what you really want to consume. They're like in leafy greens and whatnot. And so you'll see people have problems with diets, but overall it's a great place to consider starting. I think I'm kind of digressing, but if you can do testing, you do testing to. This was all about sarcoid and in the thyroid, or sarcoidosis. So that's a very good thing to consider. Let's see, what else are some of you guys saying? There's a great session. I know it's going on right now. Let's see, how late am I? That's all right. I know a lot of the stuff they're teaching. Let's see, what else can we do here? Just Hashimoto's cause. Hey, Christy, leg pain. Not directly, but maybe possibly indirectly somehow with electrolytes, or it's a tough connection. I'd have to research it and think about it a little bit more, but not right off the top of my head. I can't think of it. Do you think the autoimmune protocol paleo is helpful with autoimmune issues, or is it hype? Very much so. It can be extremely beneficial. The AIP, like autoimmune paleo, primarily what it's doing is it's addressing what the autoimmune paleo does. It removes a lot of the common foods that most Americans are eating that tend to be they tend to eat these foods in very high quantities. It removes them from their diet, and that in itself tends to reduce the burden on the immune system. So it just removes a lot of the very common dietary food triggers, and then it also has foods that are a lot more nutrient dense, they're whole and they're real foods. So they end up giving you more nutrients. The diet ends up supplying you with more nutrients and removing commonly inflammatory foods from the diet. So yeah, from your diet. So yeah, it can be the autoimmune paleo approach can be very helpful with autoimmune issues. I've seen it work and I've seen it not work. And if something does not work like that, then it's also diagnostic. It tells you that that is not likely the primary driver of your problem, or you're consuming a food on that diet that you would think would be good for you, but it's not. We see it all the time. When we get food testing, when we get sensitivity testing, there is just off the charts, like stuff you would never know, you'd never figure it out. And the reality is with food sensitivity testing, it's not anaphylactic. So I'm going to tell you guys something that may not make sense, but when you do like anaphylactic testing, you go to your primary care and you say, hey, I want to get food sensitivities. And they're like, well, you don't need that. And you're like, no, I want you to run it. And they run it, and it comes back, and they're like, hey, you don't have any food sensitivities, or you do. Well, they're not checking the same food sensitivities we're going to check. They're going to check IgE, E as in Edward, antibodies. And those are anaphylactic. We're not looking at anaphylactic. We're looking at IgA and IgG antibodies. Okay, those are going to be more sensitivities and more suggestive. It's not going to be as prominent of an immune response. You can eat foods and not even have a reaction that you perceive. You could be having an immune response and not even perceive a reaction. If you remove all the foods from your diet that you are reacting to, and then you reintroduce them in a few weeks or a month, a lot of times you will have a reaction at that point. You will notice a difference. But yeah, autoimmune paleo is a good place to start. Susie, can you train for an endurance event? That's a really good question, and I'm gonna say it's gonna be really tough. It just depends on where you are. Everyone's in different places as far as their recovery and what they were doing, what their capacity to carry out or do work or train, what it was and what it has been once they get diagnosed. So you can have very high level athletes that have Hashimoto's, and they can perform at pretty high levels. The risk there is cortisol production. So with overtraining, it's very easy to produce a lot of cortisol that can suppress and affect the thyroid. So I mean, there are a lot of factors, but that's probably the most common one. And then, depending if the autoimmunity is active, if you have an active immune response and the immune system's actively attacking the thyroid when you're training, it will destroy some of the thyroid gland, and it can cause fluctuations in your thyroid hormone, which could impair recovery and cause problems with maybe endurance. So it's lots of factors there. You definitely want to try to dampen the autoimmune process the best that you can, and then you want to try to train smart. It can be tough. Really, the approach and what I've been trying to develop is a process to take people from, all right, what do you start with the very basics to dampen the autoimmunity, and then balance blood sugar very effectively and balance hormones. That's really important. And then from there, go into optimizing weight and cellular function, or really mitochondrial function. That may sound like completely like a different language to some of you guys, but the mitochondria produce energy within the cell. And then from there, step 4 is take that improved physiology, that improved energy production ability, and start achieving optimal fitness and health with it. So start exercising and start really, we had some lightning there, start optimizing. Here I am on the 5th floor at a window. Anyway, really doing taking that kind of approach. That's really what I'm really kind of aiming to do, or give people the opportunity to try to step through those things so that they can have, not just feel better, but maybe have better health on the other side of this than they ever had going into it. That's really my goal. Put you in a much better place than you ever thought you could be coming in. Sprouted grains, April, I just basically try to stay away from them. They're probably okay, but I was a fan of like Ezekiel bread at one time, and then I was just like, God, this stuff is horrible. For me, I would eat that stuff and I would be like, wow, this is just interesting. It's like a blanket of Brussels sprouts has been compressed and dried or something, and I'm like, oh. So anyway, I don't recommend it. If you want to incorporate it at some other point in time, then after you've gone through removing, if you need to, go through removing foods, healing the gut, balancing the immune system. Then I might suggest reintroducing a food like that. Let's see, what else? Hey Linda, I do follow Autoimmune Paleo somewhat. What I usually start people on in our 6-week Hashimoto's transformation program is a diet that's Autoimmune Paleo-esque. It's pretty close to it, but you'll find that there are a lot of people, if you look at Autoimmune Paleo diets, you'll find that there's all these different versions of it, slight variations of it. So I try to take people through that type of dietary approach. It's like elimination / Autoimmune Paleo, and then we go through dietary and lifestyle. And one of the things that I really try to do is, like with my programs, is I try to teach people a process of assessment. So I have you fill out like a form, and then I walk through in a presentation what those results mean, and then I try to help you understand what supplementation might be beneficial based on those results, right? So that you can then go into we use, I work with people all over the country, around the world, and we use an online nutraceutical dispensary company called FullScript. And I have like a customized pharmacy in there that I've handpicked, and I have different categories for it. So people can, so if they go through my program, it's like, okay, yeah, so here's the dietary approach, and then here are all the lifestyle things I want you to be aware of. And then let me help you self-assess so that you can determine what supplementation might be better for you. Because I'm going to tell you right now, if you're autoimmune, you don't just, and it's autoimmune thyroid, you don't focus on the thyroid. That's not what you do. What you do is you focus on autoimmunity, and by focusing on autoimmunity, you have to look at the gut. So when I have you take an assessment, you might find that you have problems with, you have poor digestion. Let's say you're constipated. You have poor digestion. You have low stomach acidity. You then have adrenal gland problems. You have dysglycemia, and so you'll figure out you have like this web of what I call the web of dysfunction. And my assessment process is designed to help you kind of determine what your worst problems are, so that you can prioritize what you do for yourself. And then because a lot of people are like, well, what supplements do I take? And they're like, I guess I'll just take, bone broth. Which actually Jordan Rubin and Josh Axe are here at this seminar. And they're talking a lot about Ancient Nutrition, which is a company that they started, which is amazing. I mean, really, they've sold me on the idea of their bone broth. I mean, what they're doing is some really revolutionary things, and I think it's a really good product. But that's not guys. That's not the only thing you need. Let me just say that. I mean, it's a good generalized thing. But what I'm trying to do is how do I bring semi-customizable, as customizable as possible, healthcare and education to you guys, right? So that you're not just like doing everything completely generic, right? If I can help you develop on your own, because I can't do it with everyone, I can't talk to every single person, but if I can create a system that's simple to follow, so that you can help yourself, then that's really what I'm trying to do is help you customize and figure things out so that you can help yourself. I'm trying to think where I was going with that. Supplementation, was it maybe? Anyway, let's see. Autoimmune Paleo. Yeah, I think that's where I was starting. Carrie. Sounds like my room service is getting ready to come in. Let's see what happens. I know she's outside the door. Guys, Mindy, so you can, guys, I do like phone consultations. I only do like one a day, and we also do antibody testing with people. So we do that as a community service, so people can request like antibody tests from my office. Like we'll actually can get them done at a LabCorp, and you can request that. We'll receive a notification, and we can send you like an order form just to get your antibodies checked to see what your antibody levels are. And the phone consultations we do like one a day. So there's all these different things that we kind of do as a community service, and I can only have one time slot per day to do a consultation, like for 15 minutes, or review antibody results. So with that, I mean, you can get that you can go to our website, or you can go, so like drbradshuk.com, you can go there, and if you scroll down on the page, you're going to see somewhere request a consult with Dr. Shook, or get your antibodies checked. You can also access them in the Greater Hickory Thyroid Support Group. There's probably posts somewhere. My staff tries to, it's really hard for us to follow everyone and keep up with everyone, but there's places where you can request that stuff and you can get a consultation. Now to get, like, if you want to be like a distance consulting client, or you want to come into the office as a patient, then for that you can request an appointment too. There's you can actually request an appointment. If you scroll way down on our website, you can request an appointment, or and basically you just fill out a form and put in your name and phone number. My staff will get it and they'll call you and talk to you about it. But if you want to learn about distance consulting or anything like that, you can just go to our application for care page. So go to drbradshuk.com, application for care, and you can read about kind of like how we work with people, so you can figure out if it's if we might be a good fit for one another. Anyway, you can check that stuff out. Let's see, Angela. You're sick. Thyroid meds make me sick. Man, that's a tough one, Angela. About the low cortisol. You've been on AIP. You've been doing great. Sounds like you've made some really good success with weight loss. Thyroid meds are making you sick. Well, that's a tough one. That's really hard for me to answer. I'm not really sure. Low cortisol. There's a lot of different reasons why you might have low cortisol. It's really. I wish some of these questions were really simple, but it really requires a lot of discussion as to kind of like what's actually happening to better understand, so I could even speak with any type of, because last thing I want to do is give you guys information that's like not helpful at all. So I'm sorry, Angela. I can't really. I'm not really sure how to answer that one. Hey, Sherry. Sherry, So Sherry asks, what causes a person's thyroid to keep fluctuating from hypo to hyper in months? She said it keeps happening. All right, so here, this is one. I've got a video on this. It's great, but I can explain it to you really quickly. But I've got a video where I'll go into more detail on it. But basically, hypo to hyper and back and forth. One of the really common things that we see is Hashimoto's, which is an autoimmune thyroid condition where the immune system attacks the gland. So when the immune system attacks your thyroid, what happens is it destroys some of the cells of the thyroid, and that spills thyroid hormone that's contained inside those cells into the bloodstream. So guess what happens? That spikes your thyroid hormone. So if your thyroid hormone's here and you have an autoimmune attack against the thyroid, it can spike the thyroid hormone, causing you to be hyper. Over a few days, it might burn down, you might come through it, and then maybe a week later, it might actually be hypo. Well, depending on when you get your blood checked, if you go to your doctor's office and they check TSH, one of the things you're going to find out that happens, hopefully the phone doesn't fall, is that when your thyroid hormone's high, your TSH is low. So when you have that autoimmune attack and it spikes your thyroid hormone, it suppresses TSH. So if they're just checking TSH, you go in, or if they're checking both of them, the same thing will happen. They'll go up and down depending on this autoimmune process. And when it's occurring, and when you get your blood checked is really important. So you'll find that someone that has Hashimoto's, you can check their TSH every month for a solid year, and it's going to be hyper one time, hypo the next time, it's going to be normal the next time, and it's going to be up and down all over the place. And titrating their thyroid medications is going to be extremely difficult because you can't see it when the person's not under an autoimmune attack. I mean, it's really difficult to know what you're looking at. So you have to dampen the autoimmunity if you're going to have any kind of success with really figuring out first of all, what's the capacity of the thyroid to even make the hormone. You don't really know, because you can't tell what it can make and not make. So you've got to dampen the autoimmunity so that you can get more of a baseline and see what's happening. I hope that makes sense. Sherry, that's a very reasonable mechanism for what's happening. Yeah, Crystal, a lot of questions I get is about the testing. And I'm going to tell you, the testing none of it's covered by insurance. We use Cyrex Laboratories a lot to do that. And so let's talk about immunological testing. I mean, there's so many complexities, guys, with the testing. You got to understand that this world, what I'm teaching you guys is about, it's called functional medicine. And functional medicine, under a lot of insurance guidelines and insurance plans, is not a covered service. And I mean, you can ask the people that I've worked with. I mean, our appointments are an hour long, easy. And so for one thing, there's no codes to bill for it. The other thing is that the insurance companies don't deem it medically necessary. And medical necessity is a term that they use to determine whether or not they're going to pay for something. And they determine whether or not they're going to pay for something, and they define medical necessity based on best practice guidelines. Okay, now follow me down the rabbit hole here. Best practice guidelines are synthesized or developed from research that is reviewed by medical physicians and healthcare administrators of that healthcare plan. And they determine what they feel is reasonable based on what they consider best practices, right? So here's the thing. Everything that we do, how many of you guys suffer with a thyroid problem and you're like, nobody will run the damn test. Nobody will check me out. Nobody will look and see what all's going on with me. And I feel like everyone wants to kick me out the door. They laugh at me when I talk to them about my thyroid. My endocrinologist shuts me down. That's the standard of care, guys. That's what you're getting. And it's because it doesn't change their treatment plan. It doesn't change it. And listen, here's the deal. Like if the doctor ordering the test, if that does not change their treatment plan, it's not medically necessary, right? And so what's the doctor going to do anyway if they determine you have Hashimoto's? Nothing different. They're going to give you thyroid hormone replacement and tell you they're going to wait until the gland burns out, and as if it's a smooth process. It's not. It's not a smooth process. So the testing, before I digress too far, I just wanted to highlight the fact that none of the testing, like everything that we do, like I order very expanded panels on people because there's a lot more to what's happening with you guys than just your TSH level. And that's not considered necessary under insurance policies. So when it's not considered necessary, they're not going to pay for it. So listen, I fought this fight for a long time when I first started, working with people doing functional medicine. And we kept seeing that they would say they would cover it, and then they wouldn't cover it, and then we would bill it through labs. So for example, so usually I'll have an appointment with someone first, and then at the conclusion of the first appointment, we will determine what tests are appropriate. Usually it's an expanded blood test through LabCorp, right? Well, it's not through insurance, and I'll tell you why. It's because it's not considered medically necessary, number one, under those insurance guidelines. The panel that we get is, right now it's $299. That panel, I've seen it before, first of all, before I even started into using a co-op that we can get it through at negotiated rates. When that panel was ordered through LabCorp and we tried to bill it through someone's insurance, $2,000 to $3,000 for that panel. We get it for $299 at a negotiated rate, and they're still making money on it. So you look at that and you're like, how can that be, right? So really, the thing with these tests is that they're not considered medically necessary. So I try to do the least amount of testing to get the best results, and only do what's reasonable. But so let's talk about some of the tests. So blood test is always where I start after that first visit, because that lets me survey your physiology and figure out what's going on, figure out what direction we might want to consider going with testing. Basically, after I review that, I typically send someone a report on what I found, and then I follow up with them on a second appointment where we discuss their results in detail, and we say, like, look, okay, this looks like this could be happening. This could be one of the main drivers of your process. And then we try to put together a dietary and supplemental based approach. And if there's other tests that I think might be reasonable, then I'll say, okay, listen, let's consider some other testing, and here's why. Now, so a lot of times I'll start with, probably the most common test I order is like a stool panel. And you're looking at, anywhere, depending on what we do, you're looking at about $500 to about $700, right, for one test. And I get it, and that's why it's like, you gotta, everyone's gonna have different perspectives. It's a lot. It'd be nice if it was covered, but you gotta do this, guys. You look at some of these tests and you're like, okay, it's expensive, but compared to what? I mean, really, you look at the cost of someone that's like diabetic and on insulin, or look at someone that's on dialysis, or look at some of these medications that people have to take, and it is thousands of dollars and thousands of dollars. And then the quality of life, you've got to compare it, like compared to what? Okay, it's expensive, but is it expensive, or is it really an investment? And some people don't have that even an option. It's like, no way, even if I scraped and clawed for what I can do, I couldn't afford it. And that's why I always want to teach everything that you can possibly do so that you can try to help yourself. But sometimes you reach a point where you're like, man, there's no more trial and error. There's just nothing else I can think of to do other than get quantitative information. So if you can afford to invest in the testing, I mean, I would tell you, like, so let's say one test anywhere from 500, testing could be anywhere from 500 to literally, if we did all the testing, like some people, and so it's always different. Like every time I recommend testing, it's always different. It's never the same from one person to the next, because I'm not going to recommend it if I don't think you need it. So the testing can be anywhere from, if you wanted to get advanced testing, from 500 to, I mean, you could spend, and I'm not exaggerating, you could spend $10,000 on testing. And I mean, jaw dropping, I know, but guys, I don't have any other ways to get the information. I don't have any other ways to get it, and it's not always necessary. And I do everything I can. I mean, that's a very small portion of people that do that. I try to do everything I can to help people help themselves. That's what the goal is. But when you get into like other testing, yeah, it's a bunch of crap. It needs to be covered. We need coverage for this type of care. But you understand, guys, if the entire healthcare profession in the United States shifted to this type of healthcare, you wouldn't be able. There would be too much demand, and the doctors couldn't cover it. Because guess how many people I see in a day? Guess. You guys take a guess. How many people do you think I see in practice during a day? Now, I work Monday through Thursday right now, and I'm there for at least 8 hours. I see 2 to 4 people in a day. 2 to 4. You start thinking about this. Now, I want you guys to think about this. Your average primary care physicians and people are going to see 30 to 50. 50's high, but 40's probably about an average in a day. You cannot deliver the type of healthcare we have that like functional medicine care under that model. It's not sustainable. And the doctors, guess what? The 40 or 50 visits that they're seeing, they need to go faster because there's too many people for them that they need to see. You got to understand too, your doctors are not, a lot of them, they're not independent. They're an employee, and what they do is dictated by that employer. And if they don't keep up with that production pace, they're out the door. They're written up, they're fired. And the doctors also have this, they're compelled to want to help their patients. So they feel obligated to do everything they can to help people. So your doctors, man, they get villainized a lot of times. But man, you wonder why there's really high suicide rates amongst physicians. It is not an easy task to try to care for people, because a lot of people don't realize the pressures that you're under. They don't realize the limitations that you have. They just think, well, why don't you do this for me? And it's really doesn't, in a lot of cases, it doesn't take into consideration the factors that are placed upon, and the stresses and things that are placed upon the doctor to conform to something that they have to follow. I mean, they don't always have the options that sometimes we perceive or we think that they do. So that's interesting. I know, Crystal, I hope that helped answer your question. Yeah, Sonia, Hashimoto's and celiac are very common together, primarily because if you have Hashimoto's, you have antibodies against thyroid peroxidase and or thyroglobulin, which are in the thyroid. And for TPO, thyroid peroxidase is the most common target for Hashimoto's. And the protein structure so when your immune system is looking for something and attacking it in the body, the protein structure is what the immune system is looking for, right? So your body's made up of proteins. Foods that you react to have proteins in them that your immune system could react to. So the protein structure that comes into that your immune system's looking for, let's say it's thyroid peroxidase that your immune system's attacking, TPO, thyroid peroxidase. Thyroid peroxidase has a very similar molecular structure to transglutaminase in the small intestine. So your immune system, that's why gluten's a problem too, because the molecular structure is so similar that it mimics your TPO, or the TPO mimics the gluten or the transglutaminase, this enzyme in the gut. So for you guys, celiac disease, one of the markers that's checked is transglutaminase in the small intestine. If the immune system's attacking it, if there are antibodies against it, that's one of the markers for celiac that can indicate that you might have celiac. So yeah, they're so similar that if you have an immune response against one, you're likely to have it against another. Now the thing with Hashimoto's is that the really important thing with Hashimoto's is that if you have autoimmunity against your TPO, thyroid peroxidase, which is the most common target, okay, you're very likely to have expanded autoimmunity to like transglutaminase, as with celiac, to you're likely to develop, you're more likely to develop pernicious anemia, which is an autoimmune anemia where the immune system attacks either the parietal cells or intrinsic factor-producing antibodies is what will be made. That's in your stomach, and that helps you to absorb B vitamins. So when people have pernicious anemia, they become anemic, and their blood cells get really big inside, big in size, and that's due to an autoimmune anemia called pernicious anemia. And you see this very commonly. Like, I'm going to tell you the ones I see most commonly with Hashimoto's. So it's celiac. It's pernicious anemia, and it's also cerebellar antibodies. So brain autoimmunity. So the cerebellum's the back part of the brain. If you look at a brain, it kind of looks like a mini brain at the back. And the cerebellar, a lot of this work has been done by Datis Karazian, and that I'm sharing with you guys, like this molecular mimicry and these compounds by Datis Karazian, who I've learned, I credit him with almost, what I think is the best information I've ever learned in my life. Datis's work is what has got me to where I am. And so Datis Karazian worked very closely with Aristo Vojdani, who is the chief scientific advisor and officer at Cyrex Labs, and they've done a lot of research on molecular mimicry, and they've done research on lots of different things. So what they found, they're really, all of their tests are formulated to help us identify triggers to the immune system that drive autoimmunity. And a lot of the stuff I'm sharing with you guys, like cerebellar, so if someone has Hashimoto's, more likely to have celiac, pernicious anemia, and cerebellar antibodies. That's really from a lot of their work and the studies that they did, and where they researched this concept called molecular mimicry, where tissues or proteins look similar to one another, so similar that the immune system can mistake them and mistakenly attack one for the other. And that's where a lot of that research and information comes from. So I hope that helps, Sonia. Hey, Samantha. It's, the tough thing about bringing this stuff to your doctor's attention is that a lot of them they can be really closed off to it. I'm not making excuses for them, but they're not aware of it. One of the best things I think to do is to maybe get some information. So I've done some training with a great organization called the Institute for Functional Medicine. So if you go to functionalmedicine.org, I believe, you can get some information there. And I believe, if you guys don't, what I can do is I can have my staff post it in the Greater Hickory Thyroid Support Group. If you guys, hopefully you're in there, I can have them post it, or maybe we can post it here in this thread. And it's basically a one-page document explaining what functional medicine is. But some of your doctors don't have time. Some of them, quite frankly, don't care. Some of them think it's just all quackery, and if it doesn't come from the pharmaceutical companies, then it's just some sort of quackery, quite frankly. And that is irresponsible. I'm not closed-minded to medicine. I'm thankful that we have what we have, like from our primary care, from our specialists. I think it's very good. You probably have a bad, let me say this, not the best person on your team, right? You need a different primary care physician, probably. And that can be really tough. You guys need to research people off reviews and, hopefully friends, and find someone that can work with you. It's easier said than done, right? But listen, this is a movement. You guys are part of a movement. I hope you guys know that. We are part of a movement here to change how healthcare is delivered and what it means to be healthy in the country and in the world. So your doctors will catch up sometime. So I'm just gonna tell you guys, like, that's they're gonna have to catch up, right? We're a movement. So the more you guys go there and you're talking to them about stuff, you kind of just feel them out, And a lot of doctors, I've heard more and more lately about doctors being open to things. They may not understand it correctly, or fully, but they're open to it, right? So what they really need to do, I'm never anti-medicine on these talks, on my videos. They can watch it. They can go to the Institute for Functional Medicine and do some reading and research. They can look up the Cleveland Clinic, and you can look up Cleveland Clinic Functional Medicine Department, because that gives it some more credibility, right? They're like, well, who are all these people doing functional medicine? Is it just this medical doctor that's defected? Is it a naturopath or just or a chiropractor that's doing it? Is it a health coach or someone that has no training and they want to discredit it? Well, you know what? There's all those people that do it, and there's some people that are brilliant that do that. And what they really need to do is say, all right, listen, this is the piece of your team that I'm gonna be part of your team here. They're part of your team, and we're gonna do the best that we can to make sure that you're as healthy as you can possibly be. And that's really what you ultimately hope for, but it's not always what you get. So maybe directing them to like some really credible resources like the Institute for Functional Medicine. You know, I would say if they'll watch some of my videos, but probably as soon as they see me in a sauna, they'll be like, I don't think I can trust this guy. Those are all things that you just don't know. You can't know for sure. You have to do the best you can. Try to open up a conversation, have dialogue. Try not to be too pushy. Try not to be too insistent. Try not to insult them. It won't get you anywhere. You know, I was always told you get more with sugar than you do with spice, and you really do. You really do. You know, people are trying to help you, and you just stress them and stress yourself. It comes back to the psychoneuroimmunology I talked about earlier, and then earlier today. So those are all things to keep into consideration. It's tough. It's really tough to find someone, I think. Hopefully they're open-minded though, and they can watch stuff like my videos where I talk about it, or they can go to the Institute for Functional Medicine. It's just tough. It's tough because it's changing their thought processes and their paradigm, and no one wants to be the authority in healthcare and then feel like the rug's being pulled out from under them and there's someone else doing their job. Like, that's one of my biggest concerns. Like, I'm not anyone's primary care physician. I don't take that role. What I am is I'm a functional medicine physician, functional medicine doctor. What I do is I focus on helping you figure out and investigate the drivers of disease processes and implement diet and lifestyle programs, everything's temporary nutritional supplementation to help heal your body. And then I try to work closely with your primary care physician, but we have to, that's really my role. That's what I do. A lot of physicians don't want that, and they feel like, if I order blood testing, a lot of them don't really know how to use it the way that we're going to use it from a functional medicine perspective. So it can be a little intimidating, and sometimes when you've been perceived as the authority, saying that you don't know makes them feel incompetent somehow. Dude, I will tell you right now, I don't know everything at all. I have limitations, and I learn from the people that I work with every day, and I'm thankful for that opportunity. That's what you have to do. You just have to be appreciative of, that with information as abundantly, as available as it is, you can learn from everyone, and you can learn stories, and people's stories are really important too, because you can just really you learn a lot from people. So I try to be very humble. I don't know everything. To the day that I die, I won't know everything, and I'm not going to ever take that arrogant attitude, ever. So hope that helps, Samantha. Yeah, Catherine, I'm not a big fan at all of anyone telling you that you're just old and that's how it is. You just got to suck it up. Not cool. No, that's not acceptable. So just difficult time losing weight. Thyroid shrunk almost nothing. 175 milligrams. Synthroid. 54 years old. You were told you had to accept it. Had Cushing's at 1. Lots of things going on there for sure. That's so complex. What you're sharing there is so complex. Let me explain to you. So if I was looking at that, I would look at inflammatory markers. Let's say I would look at your history in great detail. Let me kind of help you see how I might look at your case, because it's a really complex question. To understand what I might be able to do to help, I would probably look at your history in great detail and figure out what you've done, what happened to you, what you've done, where you are today. And then I would look at blood tests. I'd get some lab testing done just to look at the basic physiology. I would look for inflammatory markers. I would look at your red blood cells to see if there's any type of shift in your red blood cells that would suggest an anemic state, or you're shifting towards anemia, which can be a lot of different factors: iron, B vitamins, autoimmune, lots of different problems. Things can cause anemia, lots. So inflammation, I'd look for anemia. I'd look for blood sugar dysregulation. I would look at GI and liver. I would look at the thyroid hormone in great detail, about 9 different markers. Look at vitamin D. I would look at a urinalysis. Look at lipids. Look at electrolytes. Look at 5 different iron markers. That's kind of how I would look at it, and I'd say, all right, what's going on with this person? and then I would support what I found, or I might say, well, based on this, you might want to consider some other testing, and these are some different options, but these are different ways we can approach it. That's always how I do it. Listen, I try to give anyone that I work with, and Catherine, I'm sorry that I can't be more specific, but you really have to look at each person that you're working with, and you have to try and you support what you find, right? So sometimes people come in and you're like, well, we've had all this stuff done and nobody knows what to do. And sometimes you don't have a crystal clear diagnosis. But what you do know is you can look at human physiology and you can say, okay, this is what's going on with them chemically. Let's support these problems that we're finding, and let's see what happens. Let's trust in the ability of the body to heal. Let's get testing. Let's do some things the best that we can to help. And you know what? A lot of times that you can see huge improvements in someone because we don't understand all the complexities of the body and what's happening. So that can be really, really beneficial. So Catherine, I wish I could answer that in more detail, but I can't. And I do a video. I've got a video on Hashimoto's and gallbladder dysfunction, and basically low thyroid hormone activity, which is completely different than quantity, right? There's a lot of different ways your body can lose sensitivity to your thyroid hormone. Is really that if you have decreased sensitivity to the thyroid hormone, you can have a sluggish or poorly weak contraction of the gallbladder, which will cause stasis, or it will cause the bile salts to sit there. And so then you can have on the ultrasounds when they look at it and they do a test and like, oh, it's 5% function or something, or you develop stones because there's poor contraction and release of the bile. So yeah, there's a few things. Every cell in your body needs three things. It needs basically you need oxygen. So that's why we look for anemias, because anemia means you can't carry oxygen efficiently, for one thing. You need oxygen to the cell. You need steady blood sugar. So you can't be hyperglycemic, high blood sugar, or hypoglycemic, low blood sugar, because your body uses oxygen and glucose, your blood sugar, to produce energy. Now you have to have thyroid hormone. Every cell in the body has to have thyroid hormone to drive the metabolic engine and use that oxygen and that blood sugar to produce ATP, your energy. So without those things, you will have cellular dysfunction. So what are the symptoms of cellular dysfunction? Well, quite frankly, anything. But every single cell, think about this, the cells of your body make tissues, tissues of your body make organs, organs make systems, and systems make you. So what dysfunctions when the cell dysfunctions? Who knows? Everything, right? Everything could dysfunction. So, I would say making sure that thyroid hormone physiology is optimized. I have some gallbladder problems myself, and one of the things, I take different supplements that have, let's see, what all's in there? You know what? I'll do another video on those compounds, but yeah, lots of different things. What is the supplement? I'm trying to think of the supplement that I actually take, what the name of that one is. They're basically supplements for the gallbladder, and they have like milk thistles, one of them. Staying really very well hydrated, milk thistle, several other things that can thin the bile can help sometimes with that bile flow. Not consuming high amounts of caffeine. If you consume coffee and high amounts of caffeine, that can actually suppress liver function, and that can impair your body's ability to release. So don't overdo that to release the bile. Hope that helps. Hey Lisa, probiotics. You know what? I very rarely actually recommend probiotics. That's kind of flies in the face of what you hear, but you really need to, when you're considering probiotics and supplementation, you really need to be as specific as possible. Like I really am a bigger advocate of diet to help support proper gut bacteria. Now, initially, for the first few months, 2 or 3 months, I might recommend a probiotic initially to help support the gut bacteria, but long term, I don't tell people to take probiotics every day. I really try to take people off of every supplement that I possibly can, because I don't think you need that. I think you need to get your nutrition from food, and that's really where it needs to come from, and you need to have an optimal functioning body to extract that, break it down. I'm going to tell you, I have all kinds of supplements on my table, but of course, I'm not just taking supplementation to support me when I'm under stress or when I need a little bit of help with digestion or to dampen autoimmunity. I take supplementation also to help me perform better with my workouts, have better mental clarity. And those are some things that I don't talk about those because that's not where you want to start. Like some of the things that I do are not where you want to start. That's more for, more for generic term like human optimization, those types of things. And that's all debatable, right? I mean, not everyone needs that, not everyone wants that. And that's not, really just being simple. A simple approach is the best, always, in almost anything. So I don't really use probiotics. I do like orthomolecular if I'm going to pick a brand. I like VSL number 3. VSL3 is a good one. Those are all good. I mean, there's lots of good probiotics out there now. There really are. Let's see. Samantha, the assessment that I do, what I did was I tried to. People are constantly messaging us saying, "Hey, what are the best supplements I can take? What can I do?" And I'm like, "Well, really? I don't want you to take any supplements unless you have to. But if you want to know, like supplementation, what I did was, I don't even know where it is. Like I can't. I'm like not. I'm at a seminar right now. What I try to do with the supplementation is that I try to take. What I've done is people ask me about supplementation. So what I did was I created basically a workshop, like a video workshop. So you can you can download the assessment, fill it out, watch my workshop. I'll tell you exactly kind of what the categories mean. Then you take that information, you can log into our FullScript account, which is my online nutraceutical dispensary, and I've got everything categorized that will correspond with your assessment. And I try to walk you through this process of like, look, don't take more than 6 supplements. Prioritize the things here. I'll give you ideas on prioritization. I posted that somewhere in the Greater Hickory Thyroid Support Group. We will post it again. I don't want to post a lot of stuff in there. I want to give you guys information to help yourself, but at the same time, I'm not trying to inundate you guys with stuff to like, hey, do our stuff. I don't want it to become that, and that's why we take anyone that posts stuff in there that's, there's a lot of stuff we can't police, but we just can't. It's too many comments. But we try to keep it as good as we can and as authentic as we can so that it's not full of, it's not a full-time advertisement. That's not the purpose of it. It's not why we started it. But yet we want to give people information on the tools that we have available for them that we think will help them. So it's kind of always balancing this thing of like, okay, do we put this in the group and seem like we're trying to sell stuff and everybody like bash us for self-promotion, or what do we do? So we're trying to figure out like a very reasonable type of schedule to make people aware of things at the same time, not inundate you guys with stuff that is. I hate seeing advertisements all the time. I get like, I'm on Facebook and it's like everything's an ad, someone trying to sell me something, but how do you convey your message? So anyway, I'm really digressing there, Samantha, but the assessment, there's actually a link somewhere in the Greater Hickory Thyroid Support Group. I promise you we will post some of these things like, hey, you want to get your thyroid antibodies checked, go here. You want a consultation with Dr. Shook, you can sign up for it here. You want to understand what supplements might be best for you, go here. You just click a link and it's going to be like you put in your email and it will take you to a page where you go through that assessment process. You can download the form. It'll give you a link to our FullScript account. You click on it. It'll open up a page and you can just put in a username and password, and it's private access to all the supplements that I've handpicked that I use as for my dispensary, and that I make prescriptions for people around the country that I work with. So those are the exact supplements that I use most of the time. So it'll give you an idea of like what might be best for you. And that's one of the best things I can tell you guys. If you're going to follow like a dietary approach, utilize some supplementation to help complement what you're doing. If you can afford to do that, then do that. And just one tip that just kind of popped into my head: if you guys are trying to eat cleaner, organic is not absolutely necessary. If someone's going to say, hey, I can't afford to eat organic, I'm just going to say, well, you know what? Then don't eat organic, but eat from the the Dirty Dozen and Clean 15 list. Just Google Dirty Dozen and Clean 15. It's at EWG.org, environmentalworkinggroup.org. You go there, get that list, and do your shopping. Get the conventional things that are clean, the conventional foods that are clean, and eliminate the dirty foods the best that you can. And if you can't do that, then I'm going to tell you, well, just get that list and try not to eat the foods that are really dirty, like conventional strawberries, conventional berries, apples, conventional celery. Those are like the worst things. They have the highest pesticide and herbicide loads on them. You don't want to get those. But things like avocados, for example, they're conventional are really safe, and there's a lot of foods that are you can buy conventionally that are safe. So you can do stuff like that to help offset cost and things. And that's really what's most important, is that you just do things that are practical as possible. So I hope that helps. Look at my watch. My staff is like blowing up my phone. They're like, "You're missing like the best lecture." Here's a great guy right now. It's Matthew. I'm probably going to butcher it, but it's a Cursoro. He's a great doctor. Great doctor. He's teaching some things, but it's all good. We got a good group here. Try to help you guys out today, a little bit today. Let's see, AIP. Hey Miriam. Started AIP. Should you reintroduce individual grains in about 4 weeks? Yeah, if you're feeling better, if you're improving, what I'll typically have people do is 4 to 6 weeks. I'll have them consider reintroducing some foods, and then see if you react. Usually that's long enough to remove a food and see if you're going to have a reaction to it. That's not a bad plan. If we know that someone is having an immune response to a food, though, I'm going to tell you right now, it's technically 6 months. You should remove the food for 6 months, work on repairing the GI tract wall, improving the immune response, and then you have them. This is the best way. Now, you want to know the very best way. This is how we can have better quantitative information. In 6 months, you have them reintroduce the food, and after they reintroduce the food and observe for change, you retest the food sensitivities, and you see if they're positive or not. If they're positive, then you got to keep it out longer. And the goal is to regain oral tolerance, so you can eat a food and not react to it. Let's see. Yeah, that sounds right. It sounds reasonable. Follow with the reintroduction, the other foods. Good job on the bone broth, by the way. Mindy, not sure about the adrenal adenomas. Most of the time when we're looking at tumors of glands that are benign tumors, you'll find that they tend to create increased output of hormone. And that's not really my specialty. Whenever we see that type of problem, I'm referring them to, or I'm saying, you've got to see an endocrinologist. Your primary care needs to refer you, because we work with people all over the place. But if you see an increase in output in hormones, those like adenomas or pituitary tumors, lots of different things like that, you've really got to see a specialist that can help guide you on treatment of that. And I don't know what, and so maybe you've seen a specialist. I mean, obviously, if you have adenomas, adrenal adenomas, then you've seen someone because it's been diagnosed. But sometimes if they're not creating a change, it's really kind of hard to know why they're there. Again, it comes back to, sometimes with people, you've got to support what you find. So you look at their history, you look at the labs that you can get, and then you figure out, what can I do to help optimize this person's physiology? Is there anything that's off here that we can do just from foundational health on a cellular level to get them as healthy as possible? And that's really how you can really start to make some changes with someone's health. And I know it's not like, well, this is the problem type of thing, but sometimes you don't know the exact driver of the process. We're just not that fortunate. And a lot of times, guys, you're never going to go wrong by supporting your basic health, physiology, and nutrition. You're just never going to go wrong. You might not be perfect on what's driving your process, but you're never going to go wrong there. Hey, Kimberly. Hashimoto's and gastroparesis. Man, that's a tough one. I've seen gastroparesis. I've seen it before. It's just really tough to figure out if you can recover from it. Do everything that we can to optimize the physiology, to dampen the autoimmune process. With the gut and slow GI tract motility, we want to focus on vagal nerve stimulation. So that's a brain stem, a nerve. The vagus nerve originates in the brain stem, and it innervates the entire digestive tract. So we want to try to stimulate the vagus nerve as much as we can. And so chewing, swallowing, gargling, things you can do during the day can help to prime that your vagus nerve and put stimulation into it. Other things that can improve vagal nerve tone are like enemas, and here's how. I mean, you do an enema, you're putting fluid into your rectum, you retain it. The retaining and the holding of the fluid without expelling it actually stimulates very strong afferent, what we call afferent nerves. So those nerve endings that are in your rectum and your sigmoid colon, that lower colon, the distension of the water, that's all firing nerves, and those nerves are firing up to the brain, making your brain colon gut connection, your brain more aware of that. Okay, it's a stimulation to the brain. It's not just like people think that an enema is about eliminating toxins. No, I think one of the real benefit is actually that you're improving the gut-brain connection, and you're really targeting that neurological function. So some of you guys know that I've got some training in functional neurology. I'm not a diplomate or anything, but I've got training in functional neurology. I understand it pretty well. I mean, I'm not. I often work with people and can give them ideas on things to do, but we're not doing that type of rehabilitation in our practice right now. But Datis Karazian is who he's a functional neurologist. Datis is a genius, to say the least, and he's a guy that I've learned so much from as far as functional neurology goes and functional medicine. I think he is the best in the world. I do, and I absolutely the best in the world. And he has dedicated his life to teaching others and researching. So you guys have a lot of, should be gracious, thankful for Datis, because Datis and people like Dr. Vojadani at Cyrex Laboratories spend their time to try and research and figure out a lot of these drivers of these processes. And we are fortunate enough to benefit from their knowledge and their experience to help us determine what's causing our problems, right? So, Kimberly, with the gastroparesis, just to kind of go back to that, I just really can tell you that that's something that it's a tough one. You really, what I try to do is just look at what's happening and work to the best of our ability to address improving systemic function, improving thyroid physiology, every single thing that we can find, dampening the autoimmune process. There's a great panel that I love to run. It's not something that is always necessary if you know you're autoimmune, but so in some cases where people come in and they're like, hey, we don't know what's really causing our symptoms, it doesn't make sense, right? Sometimes I'll order this test called it's a 24. I think it's 24. Sometimes there's all these different numbers, but it's a multiple tissue antibody panel. So it looks at different tissues of the body, and it helps to determine what tissues of your own body your immune system is reacting to. And it helps you to kind of flesh out, is there expanded autoimmunity to other tissues? And it goes from brain to bone. 4 neurological tissues like tubulin, synapsin, there's 4. I think cerebellar tissues that I talked about earlier. It looks at parietal cell, so for like the pernicious anemia. It looks at GAD65, which you'll see sometimes with anxiety, which we see a lot with Hashimoto's. GAD65 is an enzyme that converts glutamate into GABA. GABA is a neurotransmitter that sedates and slows things down. Some people would actually develop autoimmunity to GAD65. It's an enzyme, and they can't take their glutamate and make it into GABA that will calm them down. So they have anxiety. They can't stop sleeping. They perseverate. They just focus on one thing, and they can't shut their mind off. So you'll see that that's actually expanded autoimmunity, and you've got to address the drivers of the autoimmunity to get some of those things to dampen them, to have the best chance to dampen them, because there's no guarantee with any kind of testing that stuff is you're going to have perfect results, because there's just a lot of, it's not that simple, right? You've got to try to look at every possibility and come up with the simplest plan to address as many of those things at one time that you can. Hey, Aaron, I don't feel too bad about daily probiotics. I mean, I don't think it's going to hurt you. If you have like bloating, it could be a problem if you're taking one with like inulin or some of these prebiotics in there. That can be a problem. So you don't necessarily want to take a prebiotic if you're bloating and you're having problems with digestion. That can be small intestinal bacterial overgrowth, and you want to take like an SCD-friendly probiotic. So we have one, like I use in our full script account. I think there's one under, I've got categories. One of the categories is SIBO, S-I-B-O, stands for small intestinal bacterial overgrowth. If you go to like it might be the basic or the comprehensive category, you can look and there's one that says, I can't remember who makes it, but it's a probiotic and it's SCD compliant. So that means specific carbohydrate diet. It removes a lot of those prebiotics, which are like FODMAPs, which is an acronym for fibers and sugars that can ferment and promote bloating. So probiotics are good. I mean, probiotics, we know that the microbiome of the gut, so there are 10 trillion gut bacteria, or wait, is it 100 trillion? I can't. It's either 10 or 100. Like your body has like 100, has like 1 trillion cells, and it's like, I think it's 100 trillion gut bacteria. So your bacteria in your gut, they outnumber you by 10 or 100 times, one of those. The point being, they're really important at helping with immune system regulation, vitamin production. There's so many things we don't quite understand about our gut it's profound. Let's just say that. It is a very, very important area. Hey Sharon, test TPO to see if immune system is improving. Guys, I have a video on the antibodies, and I'm going to tell you, I'm going to summarize it for you. There's a lot of experts out there, people that I highly respect, that will tell you if your antibodies are getting better, then your autoimmunity is getting better. If they're high, it's getting worse. Show me that literature. Just show me the research on that so that I can make that statement, because there's nothing more than I would like to be able to tell someone, hey, your antibodies are coming down, you're doing better, antibodies are going up, your autoimmunity is worse. Because what I know and what I've learned from Dr. Karazian and some other people is that the antibodies fluctuate throughout the day. If we checked your antibodies 4 times today, they'd be high, low, and does that mean you're better? Or does that mean it's just how the immune system's responding? The way I use antibodies is to tell me if the autoimmune gene has been turned on, if the autoimmunity, the genetic expression has been turned on in your autoimmune, and you've lost self-tolerance. Okay, that's what I'm really looking at. That's how I'm using it. I'm not using it as a way to follow up and determine whether or not you're getting better or not. It's not a way to use it. You can't use it that way, because there's a percentage of people, about I think it's 5 or 10% of people, that are seronegative, no antibodies, but yet Hashimoto's is still occurring. Okay, it's really important to understand that. People that have a white blood cell count total below 5, those people have less white blood cells, so they have less of a capacity to make antibodies. So we see people that come in and they're like, oh, there's no antibodies, so I'm not autoimmune. I'm like, wait, it really looks like you've got Hashimoto's. Your history would suggest that, let's say it's a more typical case, problem started around one of the 3 Ps, puberty, pregnancy, perimenopause. Problem started around one of those times. Let's say it was after pregnancy. You're definitely hypothyroid, maybe some postpartum things going on. Your weight's fluctuated since then. Maybe you're on thyroid hormones, and the thyroid hormone medications have had to be adjusted several times, but there's no antibodies. That is like, if it walks like a duck, if it looks like a duck, it's a duck. If it talks like one, walks like one, it's you've got to use some judgment there. So what we've seen is that if someone has white blood cells below 5, it's typically more suggestive of immunosuppression, suppressed immune system, which can be due to chronic immune stimulation, infections, environmental chemicals, foods. And they have less of ability to make the antibodies. So it'll come back negative, and you might think, oh, great, I'm not autoimmune, I don't need to worry about anything. Sometimes that's not that clear. So what you have to do is you have to work with the person as if they're autoimmune, and you have to say, look, we don't know, but this is what I think. And what you'll see is that some people, their white blood cell count comes back up to a normal level, and they test positive for antibodies. Really, really, and you're like, well, great, you made me autoimmune. No, you're already there. Now we just have a competent immune expression. Okay? I'm with you, Linda. The whole system needs to be reformed. Yeah, Sharon, glad that someone support me on that one. The best practices crap all the time. What you find out, guys, is that unfortunately there is a division. The reality is, and I'm not going to say it. Well, I'm not going to try to spin it at all. I mean, the reality is that a lot of healthcare people that have. I mean, I'm here at this conference, and there are actually home healthcare companies here that are really trying to pioneer different things. I would never in a million years have imagined I would see this. But home healthcare companies here that are trying to figure out different ways that they can capitalize and help people in home health have optimal health. But their clientele is 100% millionaires and billionaires. That's who they work with already. And, you know, okay, I see, I know, but the reality is that a lot of people right now in healthcare, they don't have access to what I'm trying to teach you guys at all, unless they have money to afford to have consultations and testing, and you know, that's not the average person. Dude, I did not, my family never had that chance. And when I was growing up, I mean, I had my mom worked in hosiery, my dad built furniture. You know, I come from a blue collar family, 8th grade and high school educations, my parents. So I understand. I try to teach the most basic things that everyone deserves to know, what I feel like everyone deserves to know. There are people here and they talk about writing books and stuff, and I was so glad to hear some people talk about book writing and how they think it is actually a waste of time and productivity in a lot of cases. And I agree. I am not going to take time to write a book when I can teach you guys what I can write in a book in a very short period of time. And I can summarize it a lot better. I can tell you what diets to consider. I can tell you what supplements to consider. I can do all that stuff in a video, and then I can answer questions real time like this. I can try to anyway, and give you some feedback, so that you guys can take your own health. I mean, I'm not writing a book. I'm just not going to do it. I don't care about that prestige or any of that crap, quite frankly. I don't need to be a New York Times bestseller. I don't aspire to any of those things. I just want to give you practical information that can help you help yourself, and then give you the perspective on the things that you might want to consider doing as I know it. And I'm not like the know-all, I don't know everything, but I have definitely been exposed to and had been fortunate enough to learn from some people that are really brilliant, and I continue to have that opportunity, and I don't take it lightly. So I'm going to keep teaching you guys what I learn. Yeah, it's not, my phone's not charging, Lisa. It's probably going to crash on me, and I'm going to be like, no photos, no nothing this evening. My kids will be calling me and be like, Daddy, what are you doing? There's no, like, my phone's dead, guys. Thank you for that, Francine. I appreciate your, I try to be a one of my in the morning, I use the 5-minute journal. It's a great book. You guys should get it. And I do the three things I'm thankful, three things that I'm thankful for. And there's one that says I am, and then you fill it in. It's kind of like an affirmation. You just fill in like I am, and you just keep writing what you are, the things that you want to speak into existence. And one of the things is like, I want to be an inspiration. So I want to be inspirational. I want to be a good teacher. I want to be a good role model. Those are all things that I aspire to be. So when you say, you seem like a very great doctor, I appreciate that. I really take it seriously. I try to, I want to leave something for my kids to say, hey, my dad did some great stuff. And that's important. Thanks, Liza. I don't know if you're still on here. These comments, I don't know how many comments are on here. I'm like way behind, but hey, good to see you, Liza. Appreciate you. Glad you got to jump on. Yeah, Samantha, it's hard to find doctors that aren't jaded. It's hard to find people that aren't just chewed up by the system. I don't know. Just I say this and then I say this, and there's a lot of doctors that don't have reviews, but you want to like look at their reviews too and see if they have decent reviews. See if they're open to working with someone. Hey, just call their office and talk to the receptionist. The vibe you get from the receptionist, and just ask questions like, look, here's the thing. I've got Hashimoto's. I need someone that's at least open to being a team member and helping me with my Hashimoto's. And being willing to, if I work with a functional medicine doctor, to being open to like the reality and that's something that I believe in, that I value, and that I want to use diet and nutrition. And I want to know that they're not going to chastise me and make me feel like I'm a bad person for wanting to do that. I want someone that's willing to be a team member. Just ask the receptionist. You get a bad vibe, it's not the right office. And look at reviews. I mean, that's the best thing I can tell you. And not everyone has reviews, and that's not always accessible in your area. I mean, we have some, but mainstream doctor experience, thanks. Hey, Gary. Yes, yes, the supplement costs. There was a lot there, wasn't there? CDC cover it with insurance. Yeah, yeah, Lisa, I agree. I agree. There's, I'm not a conspiracy theorist, but I'm going to tell you, like Lisa mentioned, we need to present this to the CDC, et cetera, to cover, so that this stuff gets covered with insurance. More and more, I think where we're going to make the most progress there with self-insured, people that are self-insured, because they have, like there's actually there's an interesting network of doctors here. Like I have seriously met some extremely visionary people here that's, it's really inspiring and gives me ideas. But I met a guy here, and they're putting together a network of doctors around the country that are going to self-insured companies. And what they're finding is, like, these self-insured companies are paying for all their healthcare costs. And so they might have one person that has diabetes, and it's costing them like $50,000 a year. And they're like, if you can just cut this in half, we'll pay you $25,000 to help reduce this. We'll pay you whatever we can to help these people lower our expenses, improve their productivity and their quality of life. So the employers, that's probably where we're going to make the most progress and show improvement, right? The problem is with those types of models with the self-insured employers is that the employer wants it, but the employee may not give a crap about it, quite frankly. That's the problem. So you got motivated employers. You go into a business or a large organization. You teach what you're doing, but if the people don't want it, your message falls on deaf ears. And that's why it's like, I always tell, like family. There's nothing more than I would like for some of my family members to do, to follow my advice and listen to me. It's just not happening because it's not bad enough. They don't have their why, their reason why. Their reason to be better is not important enough for them to go through the pain of change. And that's a shame. So if your message falls on deaf ears, it doesn't matter. I always tell people you can't pull a rope. It's why I don't work with people that aren't motivated. I mean, why would I? Why? We have people that contact us. Let me give you an example. We have people that contact us that are extremely pushy and think that because they have unlimited resources to do whatever they want, that I'm going to work with them. I will not. Sorry, guys. I don't work with everyone. And I especially, I select you as much as you select me. And so when people, this all comes back to motivation. Sometimes people think they can buy their health. You can't buy your health because guess what? Everyone has to make the effort to make change. That is the biggest problem that I see. They feel like it's too complicated. It's too hard to change. My life's in the way. All these things are in the way. Well, I understand, I'm not gonna make an excuse for you because I worked. One of my first patients. Seriously, one of my first patients. I went to so in our area there's a outreach center in the mall for one of the local hospitals, and I was talking about fibromyalgia and thyroid dysfunction. And I was in there and I was talking, and seriously, I show up, and there were like 7 people there. I don't care. I talked to one person, but 7 people there, and one lady was literally obese, wearing a tattered T-shirt, wearing cut off like sweatpants as shorts, wearing Crocs that looked like they'd been dragged through the mud, and a cane, and had her arms crossed, resting on her stomach, head down. And she was like, I thought she was completely checked out. So I was like, man, this is someone that's like just, I didn't know, I didn't know if there was like mental illness. I didn't know what was going on, but I always try to come from a place of gratitude and compassion and try to help everyone that I possibly can. So I saw this other girl I saw a younger lady sitting beside her. So I'm teaching and I'm going through this. At the end, everyone leaves and, say thank you, but they hang around and the girl comes up to me, the younger girl, and says, hey, my mom needs a lot of help. And, I was like, okay, have her come into the clinic. So she came into my office, and literally you're talking like no money. Like it was rough for them. Like really, really rough living in a cockroach infested home. Going to the food pantry. But this lady had a determination to succeed. And she was exhausted, could barely function, no energy, but she had a serious fight in her, and she had a very strong why. She wanted to be healthy for her family, for her future family. She wanted to be healthy for herself. She knew that wasn't her, and she was determined to be healthy. So I teach her. what I teach her the stuff to do. I actually had her coming in the office. I was doing a little bit more functional rehabilitation at that point. Had her doing exercise with oxygen therapy. I had her walking on a treadmill at certain times. We were doing like brain-based exercises to help rehab brain areas. We were doing functional medicine, but I had her doing paleo, and guess what? How do you think this lady did it? She went to the food pantry. She went places and she bought what she could that was gluten-free. She got help, but she was determined to be healthy. And you know what? I would love for her one day. She doesn't like cameras, but I would love for her one day to hop on here and tell you guys her story, because she literally lost, I don't know, like 80 pounds over a year. She's completely unrecognizable, completely different. Now she has her daughter has a grandbaby that she loves and that she lives for. This is the kind of stuff that inspires me to keep going. So where there's a will, there's a way, guys. One of the most important things you've got to do is figure out what's important to you in this life, and you got to use that to motivate you. And if it doesn't pull your heartstrings, it's not the right thing. I'm just telling you, you need to well up. You need to heartbeat a little bit heavy to have your motivation. Is why you want to live. And if you've got that and you carry that with you, no adversity will get in your way. You just say, okay, I failed at that. Let's go next. Next, what's next? And you're going to continue to be persevere. You're going to continue to be your own advocate. You're going to continue to learn, and you're going to be determined to succeed. And you're not going to, in face of all the aspects and things in the world that beat you up, you're going to continue to persevere. That's my 2 minutes. That's my motivational speech for today. Samantha. Let's see. I'm just looking at some of your comments, guys. How much is an office visit? So if we do virtual consulting, it's $250 for an office visit. If you come in and we do the full thing, like in my office, it's $350. If you want to do a free 15-minute consultation, it's free, and I'll give you everything I got, just like I do right here. I try to teach you guys everything you can do on your own. So just know, if money's an issue, I will do everything I can to help you out. Like, that's why on my videos I try to tell you like exactly what I would consider doing. Like, exactly. Like, no, I'm not holding anything back. I want you guys to be healthy. I want a healthy community. Because listen, everything that I can tell you guys, I'll tell you everything I know. I'll teach you everything I know. And a lot of you hopefully get better from that, but a lot of you are not going to. And I don't know what else to tell you except, okay, that's when I have to talk to you, and we have to have some kind of formal process where we work through things together, because sometimes there's no way to do things without more information. So I will try to give you everything I can. Dawn, that was to you. I don't know if you're still here, but how much is an office visit with your practice? What's the wait time? Wait time's usually about 3 weeks or so. Sometimes a little bit longer. Sometimes it's a little bit shorter. Just depends the time of year with what's going on. First world problems. It's funny, Samantha. Yes. Good doctor. I got you. I know. And there's a lot out there. I'm not a unicorn. There's some good people out there. So Kimberly, Hashimoto's and gastroparesis, good candidate for my program. And I don't know how you'll do. Like, I'm going to tell you, like, guys, I'm going to be very transparent. I try to be as transparent as possible. If I work with you, I really don't know how you're going to respond to anything I do. Some people do phenomenally well. Some people don't do well at all. And I don't know why. I can't tell you for sure why people don't do well. It's because we're complex. It's because there are other things than just the vitamins, the food, the testing. There are other things that impact your physiology. Now, most people have improvement, but Kimberly, in your case with the gastroparesis, I really don't know how you're going to do with it. I've worked with it a few times. I don't really know how it's going to do. I just don't know. And like I told you guys earlier, I'm not afraid to tell you I don't know. If I don't know, I really don't know. And that's an honest answer. Thanks, Miriam. I appreciate that. Thanks, Julie and Timothy, whichever one. I'm glad that helped you, Crystal. LDN, I think I answered that one earlier. Sharon, I hope I'm not reading comments twice. Mainstream doctor experience, yes, it's crazy. In and out. Yeah, it rarely touches you, Samantha. You guys, to sound and eye function. Rachel, inflammation of the cerebellum can cause a lot of different problems. So Rachel asked, inflammation of the cerebellum can cause hypersensitivity to sound and eye function, question mark. She's asking a question, right? The cerebellum is like a mini brain. It's a processing station. So you can see a lot of problems with cerebellar dysfunction. If the cerebellum is not functioning properly, there's literally your brain, you have circuits. So you have neurons, so nerve cells fire to nerve cells, right? And it follows a circuit. If you have problems with the cerebellum, you can have problems throughout the brain. So hypersensitivity to sound and eye function, maybe if there's like dysautonomia, like loss of sympathetic and parasympathetic functions, that's like fight and flight, rest and digest, maybe. That might actually be like temporal lobe issues though. But you'll find that if you have problems with one area of the brain, it can cause dysfunction in other places in that circuit. That's like functional neurology. It's a little bit hard to explain. I'd probably have to have a diagram. There are certain things, guys, like when you have stuff like that, Rachel, you always have to have, hopefully you've had a doctor look at you, obviously look at the physical anatomy of the ear, scans if possible, see specialists to make sure that there's no pathological processes that are occurring with hypersensitive to sound and eye function. Eye function, I'm not sure what you mean by eye function, but your cranial nerves, you have 12 nerves on the brainstem, and they all go to your face, your eyes, your smell, your taste, the hearing. Those are special senses. And like the eyes, they go through the optic nerve, which runs straight back, and it all actually integrates at the occipital lobe. It's the back part of the brain where the processing and visual processing is occurring. You pay cash and they run in and out. That's shame. Definitely a movement. Yep. Thank you for sharing the video, guys. If any of you guys like what we're talking about, please do share. Please like. Give me some love. Test, understand. Yeah. Probiotics. I think I talked about that earlier, Lisa. Maybe that was you to ask. Orthomolecular is one that I like. VSL3. There's lots of good probiotics out there, though. Awesome, Doris. I'm glad I can give you hope, man. That's one thing. I feel like I'm pretty good at connecting with people. I try to be genuine. I try to be a human being, That's why you almost never see me wearing a suit and tie. I may not look professional, but I for sure don't really care about that. I just try to be genuine. T4 is working. So what kind of test is there to check to see if your T3 and T4 is working after they are produced? Okay, so you can measure T3, T4 values, right? So you need to be looking at free T3, free T4, total T3, total T4, in my opinion. T3 uptake. You need to look at reverse T3 because it's an inactive form that can block the thyroid hormones and cause you to be hypothyroid when your quantities are normal. You really need to look at like inflammatory levels too, because the inflammation can create issues with decreased thyroid hormone sensitivity, vitamin issues, vitamin A. Your thyroid hormone receptors are vitamin A sensitive. They're dependent upon vitamin A to have sensitivity. You need to look at cortisol levels. I said inflammation already. You can't have certain mineral deficiencies, but a lot of times you don't have to test for those. You can take like a really good broad spectrum multivitamin and fill in a lot of the nutrient potholes that may be occurring. Estrogens can really create problems. This was Trina's question. She was asking about how can you tell if your thyroid hormone's working the second half, like after it's produced. How can you tell if it's being transported properly, if it's getting to the cell and being used properly? So you have to look at really indirect measures there. So like T3 uptake, if T3 uptake is low or on the lower end, maybe not lab low but lower end, that can be suggestive of high estrogens in the body, which can cause a problem with basically the thyroid hormone being released to the cell. Let's just keep it at that. I do in my whiteboard video I explain that, but then also I've got probably 6 different patterns. I do another whiteboard video and I break down each of the common patterns that I see in practice. That estrogens is one of them. T3 uptake will be low in that case. I mean, there's other reasons T3 uptake can be low, but that's a really important one. you have low iron, you take iron supplements. So if you have low iron, why is it low? Is there an absorption problem? Do you have low stomach acidity that you're not breaking down and absorbing the iron? Iron can be really a double-edged sword because it can be very inflammatory. It's more toxic than mercury if it's taken incorrectly. I like for people to take about 5 Turkish apricots, so dehydrated apricots, hydrate them and eat those per day. And we can use some iron supplementation too, but you got to be careful. It needs to be rechecked because it can create an inflammatory response called Fenton reaction, so that's an important one. Okay, what time is it, guys? Let's see. Are we at noon yet? We are. I bet everybody's eating lunch. I gotta go eat. But I don't know how long we've been talking, but I've really enjoyed talking to you guys, taking some of your questions here. Sent to next specialist. Leah, I'm not sure. They removed it last May, ultrasound, and being sent to a next specialist. I'm not sure unless I knew more about what they saw in the ultrasound. Okay. You can do it, Miriam. You can do it. Kimberly, you are welcome. Existing root absorption. Liza. I'm not sure about your question if I understand. If Hashimoto's affects existing root resorption. Not sure. If you can clarify for me, I might be able to answer that. What do I think of kombucha, Jessica? I think that kombucha is good. I think that a lot of people that have digestive problems should not use it at first because it has wild strains of yeast in it that can create bloating. So I was using it for a long time. I was like, oh, kombucha is wonderful. So I'd go get those GT tips. That's the brand that I recommend for kombucha. And I would drink them all the time, and I'd be like, man, my gut is like, I felt like I had IBS and some other things. I was like, why is this not working? Cut out the kombucha, 100% better. Now, I can have it some now, but I don't drink it like I did. It's just the wild strains of yeast. Like I react to yeast for one thing. That's one of the things like on my sensitivities that I know I've reacted to, and it seems like every time I add in yeast into my diet, I still don't do good with it. So I just stay away from it as much as possible. So sometimes those wild strains of yeast can create problems for people. They can cause, I think they can cause maybe a yeast imbalance or overgrowth in the gut with some folks. But kombucha is really good, I think, overall. I do like it. You just got to be careful with it. Listen to your body when you're consuming those foods. I remember the first time I had one of those. It was one of the. It's been several years. The first time I had one of those kombuchas, I literally had I could tell that it had high alcohol content because I was like a little bit. I felt like I had a little bit of an alcohol buzz, and I was like, wow, I did not expect it. But they reformulated them so that they're not so fermented, so the alcohol content's not so high. But kombucha, if you make it, it can be very, very very potent. So, but kombucha is great overall. I think it can give you very good gut bacteria. You just have to make sure you're not bloating with it. Okay. Wow, we have a lot of comments. I didn't realize we had all these. Try any kind of exercise low impact. Hey Alicia, you were asking about, you had a salivary adrenal profile and you're low every time except midnight. So one of the things that if you see a salivary profile, the first thing you want to look at is there's really two things. You want to look at total quantity of cortisol produced, and then you also want to look at the rhythm of production. So the way our bodies make cortisol is on a circadian rhythm that's daily, so a 24-hour rhythm. So it should be higher in the morning, start dropping and be lowest at about 3 p.m., and then start gradually rising. So first of all, you'd want to look at that profile and make sure that you have rhythm. If you don't have rhythm, one of the things that I've used in similar cases is phosphatidylserine as a supplement. And phosphatidylserine really helps to protect the hypothalamus, which helps to set and regulate that rhythm of cortisol production. So I'll have people take phosphatidylserine. We can see some recoordination of that hypothalamus, pituitary, adrenal coordination, because that's the brain. Hypothalamus, pituitary is a gland in the front. Adrenal sit on top of the kidneys. That's what produces your cortisol. That's what's giving you, that's what's being really assessed in your adrenal salivary profile. The phosphatidylserine can I've seen that help with recoordination, okay, of that cycle. So that's one thing. The other thing is if it's low, if your adrenals are low, typically low adrenals are going to be adrenal dysfunction is always secondary to something else. It's never the primary problem. Primary would be like and I say secondary because it's really secondary. So, unless you have something like autoimmunity against the adrenals, where you have Addison's or you have Cushing's or something, but still that's autoimmune that's causing adrenal dysfunction. But the adrenals are always secondary to something else. So when you see low adrenal function, very frequently you're going to see hypoglycemia or low blood sugar. High adrenal function, high blood sugar, typically. That's typical. So when I see low adrenals, I'm looking at blood sugar very closely. If there's blood sugar dysregulation, I'm going to try to get them to stabilize their diet. If they're autoimmune, I'm going to try to figure out every sensitivity that I possibly can so I can remove it from their body and calm down the immune system, calm down inflammation, and the adrenals tend to function better. Now you want to make sure that the person they're not nutrient deficient in the things that help them to produce adrenal hormones. The one thing that I see a lot of people do is when they have low cortisol is they might be like taking a bunch of tryptophan, tyrosine, like L-tyrosine. And the tyrosine is, it can give you that energizing effect because it produces the catecholamines like your adrenaline. And sometimes people take these adrenal supplements and they have a lot of tyrosine in them, and they have a thyroid problem too. So they're taking adrenal supplements with tyrosine and they have their hypothyroid and they feel like they're making progress because the tyrosine's giving them more energy and they feel like their thyroid's better. But in a lot of cases, they're really just pushing the adrenals like they're drinking, I don't want to say it's not exactly like drinking coffee, but they're basically stimulating an adrenal response. So you just got to make sure you have all of your vitamins and minerals so that your adrenals have what they need to produce adrenal hormones. Ashwagandha root can be beneficial as an adaptogen to raise and lower cortisol, but phosphatidylserine is usually what I use to help re-coordinate the cycle or the production of cortisol, and then ashwagandha can be reasonable, and then I use some other supplements to help make sure that the adrenal hormones and the precursors, the vitamins and the minerals are there that need to be there to help you produce them. Hey guys, I'm just reading some of your comments. Thank you for that, Renee. Appreciate the support and the love there. Hey Aaron. Let me see. I see you take a Plexus probiotic. A lot of people have reached out to me. I don't really know much about like a lot of the companies that are out there. I just use, some people have approached me to try to sell supplements and oils and stuff like that. And for me, there's a lot of companies that have these models where you can sell their products and you make a profit and someone else makes a profit. And there's a lot of great supplements, but if I did that, I just feel personally like I would lose credibility because it's so it just clouds the clarity and your trust and judgment of the person. I'm not saying that that's wrong but from a doctor, I need to have a doctor's perspective, someone that's like trying to help people. I have to be really careful about what I recommend, and at least I feel like I do. So I'm not saying that there's anything wrong with that, but I think that might be a great probiotic. Kind of digressing there. Hey, thanks Patty. I'm glad you've learned a lot. Thanks Brenda. Appreciate that. Appreciate you too, Jessica. Thank you. Christy, appreciate that. Karen, thank you. Brenda, thank you. I do try to be practical. Orthomolecular is good, Patty. Yeah, it's not easy finding them. A lot of people can say they practice functional medicine or integrative medicine, and that's all they have to do is just put that on their sign, and there's definitely a difference. You really need someone that's trying to be a better physiologist. That's what I try to do. I try to understand the chemistry, and I try to figure out where the chemistry is breaking down, and then what do we need to do to fix and support that chemistry. Some people just look at lab values and match a supplement with it. That's not the way it works, and that is a recipe for, I don't know, not good outcomes. I want people to get better. And I mean, not that those doctors don't either, but you got to be a better physiologist. You got to try to understand the chemistry as much as possible. That's why really, I helped myself with functional medicine for 7 years, and I kept studying it and going to classes every year, and I knew a ton, but I never felt like I was ready to teach people or to work with people. It's like, I don't know enough. And then finally someone said, they told me they had been doing it for years, and I knew more than they did about functional medicine, and why wasn't I doing it? I said, you know what, this is my passion. That's what I need to do to help people. So I started practicing it. That was what, 5 years ago, maybe 4 years. I don't know. Anyway, that's I don't even know how I got on that topic. Oh, Patty was saying people are having a hard time finding functional medicine doctors. Yeah, it's true. You don't have to have any kind of training. You can just say, hey, I practice functional medicine. Brenda. Sleep, cool with the insurance. Lisa, I'm gonna go learn a few things. I'm gonna go eat some food. So I'm pretty hungry. Appreciate that vote of confidence, guys. Tons of comments. Love to answer them all. Really appreciate you guys so much. Probably the last video I do today, but I super appreciate you guys. Please do share our videos my videos if you feel like they're helping you. Give me some love, and I'll try to help you guys as much as I can. But I'm trying to be as practical as possible. I know these are kind of long videos sometimes, and we talk about a lot of different topics. But I'm trying to create some things. What I really want to do, instead of writing a book, what if I just like created a kind of like the top things that you should do kind of in a prioritization or consider doing to help yourself with Hashimoto's and autoimmunity. And I just recorded some videos that were very specific on like the things that I recommend, give you guys ideas on some resources. That's what I'm going to try to do, because I don't want to write a book. I don't have time to do it. I got kids I want to spend time with. I got family, and I don't want to write a book. So I'll teach you guys. And you know what else? I know a lot of people are really asking for, I've had a lot of comments for not necessarily transcripts, but closed captions and stuff. I'm working on that, getting these videos transcribed. So I'm learning how I can do that more efficiently now. But I really appreciate you guys. Hope you have a wonderful, wonderful day, and I'll talk to you soon. Okay?